Every day, I'm blessed to see patients who are presenting to see if they are good candidates for refractive surgery. And there are a lot of good options that have evolved over our early days of vision correction in the late 80s and early 90s. The most common option that patients hear about is LASIK surgery. LASIK surgery has been around for over 20, 30 years now, and it works fantastic. Then the procedure, a flap is made, the flap is lifted, and the laser is applied, and the flap is put down. Quick recovery, people do excellent, and the candidacy starts as early as 20 all the way up into your mid 50s. A second procedure similar to LASIK, actually the predecessor to LASIK, is called PRK. PRK works by doing the same laser that you'd use in LASIK surgery, but it's applied directly to the cornea. You'll end up with a similar result, but the recovery is a little bit more uncomfortable the first week, and the actual vision result takes a few weeks to even months to get there. Candidacy for PRK is based upon if your corneas are too thin or perhaps too dry, and that would drive the surgeon to move from LASIK to PRK as an option. Some additional choices that patients can encounter is something called an implantable Collamer lens. These are specialized lens implants that sit behind the iris and in front of the lens. Those implants are designed for people who are very nearsighted, have a very high prescription or very thin corneas. These two criteria exclude them from LASIK and PRK. So if you're someone who's minus 12, minus 14, these are very high prescriptions, the implantable Collamer lens may be a reasonable option for you. One procedure that people don't think about or consider for refractive surgery is something called refractive lens exchange. It's basically taking the native lens and replacing it with an intraocular lens implant. It's sort of like elective cataract surgery. And most of the time we offer that procedure to people in their mid 50s onward. Why? Because LASIK, although very successful and very accurate, is not going to deliver first a very stable result because the patient's lens and eye is going to continue age, especially 55 onwards. And second, the native lens at around 55 has already started to undergo some changes, limiting the quality of the vision that you'd have after LASIK surgery. So why wouldn't people jump to refractive lens exchange? I think some patients are afraid because it's an intraocular procedure. But I try to allay their fears and tell them you are basically having elective cataract surgery and you're going to have a lens implant that's going to be fantastic, whether it's a trifocal or an amazing light adjustable lens that we can fine tune after surgery. You'll have a result that's going to give you more pristine outcome and a longer term result, and you're never going to get a cataract. We always discuss these different options with patients and try to synthesize the different choices. So if you're interested and you want to come for a LASIK consultation, of course, those are free, and I'm happy to discuss with you any of those choices if you like. Have a good one. Take care.